Obesity is a medical condition in which excess body fat has accumulated to the extent that it may have an adverse effect on health. HIV is a virus that gradually attacks the immune system, which is our body's natural defense against illness. If a person becomes infected with HIV, they will find it harder to fight off infections and diseases. HIV-infected patients mirror the trends in the general population and are increasingly overweight or obese, both at diagnosis and during HIV infection. One study looking at the diet of HIV-positive individuals showed about 64% of participants had a diet which needed improvement, and 9% who had poor diets. Many diets were low in fruits, vegetables, dairy products, and dietary fiber, while high in meats, eggs, and total fat and cholesterol consumption. Patients who are dealing with HIV or AIDS and obesity generally do not know how to find the care that they need. One study looking at the culture of how obesity and HIV/AIDS are treated determined that public health interventions should focus on the cultural context that nurture the adoption of certain identities and behaviors. Interventions that focus on cultural content from an asset's perspective may encourage health-promoting actions. Moreover, that they may help a community establish a good foundation for addressing determinants of poor health. Seen in the general population, HIV-infected patients also show an association between weight excess and adverse medical conditions. Excessive weight has been associated with various adverse health outcomes, including hypertension, diabetes, cancer, cardiovascular disease, and excess mortality among the general population. We are in the midst of several demographic shifts among people living with HIV and AIDS, with aging and obesity becoming more prevalent. In our analysis of HIV-infected patients, we determined both aging and obesity as risk factors for multi-morbidity. Attention to these changing needs across the field, from trial design to guideline development, will allow us to dynamically adapt to the changing care needs of people living with HIV and AIDS. Research has shown obesity and the HIV disease may summate. Outpatients who are given the opportunity to join the rest of the community in becoming obese may face greater risks for balance and gait problems, making daily tasks such as walking, getting up from a seated position or bed, turning around an even rhythm more difficult.
3 possible solutions: weight loss therapy, increased food education, and movable feast. One possible solution to the obesity epidemic in HIV patients is weight loss therapy. Weight loss therapy is a proven strategy to reduce fat mass and improve obesity-related problems. It is important to consider customized weight management strategies to improve physical function in obese persons to possibly prevent or improve the medical complications associated with obesity. Another possible solution to the obesity epidemic among HIV patients is increasing the amount of educational programs around the country. Many people do not know how to properly feed themselves, which could lead to obesity. With increased educational programs, uninformed HIV patients could become more informed on how to take care of themselves. The third solution would be implementing more programs that deliver healthier, whole foods to patients infected with diseases, including HIV. Movable Feast is a program that helps put healthy food on the table for people in Maryland with AIDS, cancer, and other life-threatening illnesses. This allows for patients to have access to nutritional foods with very little hassle.
If you are just coming out of cancer treatment, you don't feel like trying to make a big meal. The meals are also somewhat underseasoned and to a lot of taste for people because they're easier to digest. They're more palatable for people who may have some nausea issues. Strong flavors might be overwhelming to them. And also we have a lot of people, like any population, that have high blood pressure and other issues that could be inflamed and exacerbated by sodium and other other strong seasonings. What we provide are nutritious meals that help people stay healthy overall and also help manage things like their side effects that might be happening from treatment. And that goes a long way in helping keep people healthy.
When implementing these three solutions, obesity will not have such a large effect on HIV-infected populations, and those with HIV will be in better health and live longer lives surrounded by their loved ones.